Hey y'all, Shelley here with another tip for hospice nurses. So when I first became a hospice nurse, one of the things that I struggled with the most was not having access to immediate diagnostic equipment. So if there was some kind of a change in my patient, I didn't have any way to really confirm that this is what happened. We check the symptoms and we treat the symptoms, but coming from an acute care setting, I wanted to know because I was so used to having all of that. I was used to having the EKG and the x-ray and everything else that we do in the hospital. So my preceptor taught me that we want to, first of all, treat the patient and not the machine. Is the patient having any symptoms? Is there anything that we can do to treat the symptoms right now? Do that first, get the patient comfortable, and then determine and discuss with the patient. We think you have symptoms that indicate you had a heart attack. So you can go to the hospital. If you go to the hospital, they're going to run tests on you. It's very possible that they're going to want to do an angiogram. I explain what that is. From that, they might want to do an angioplasty or even open heart surgery. Are these things that you would want to have done? And if their answer is yes, then we discuss that they can revocate from hospice and go to the emergency room and have the care done that they want to have. If the answer is no, then we talk about, well, it's much better for you to stay home then, because you go into the hospital, even a healthy person going into the hospital is always high risk, a risk of getting some other kind of infection. Or if they're in the hospital for a few days, even doing this testing, they're going to become debilitated. And usually they don't bounce back from that very quickly. So it can really decrease the quality of life. So what we do whenever we suspect our patient has had a heart attack or had a stroke or a TIA, that's very common too. Have that discussion with them. Let them know what will probably occur when they go to the hospital, what the possible treatment options are. Do they want to go through the treatment? And if the answer is yes, then they can revoke hospice and go have the treatment. If the answer is no, we discuss how we will help manage the symptoms at home. But ultimately, it is the patient's choice. So we do share the information with them for what they can have done and let them make the decision of what they want to do. Some people will say, well, yeah, but I just want to know. I'm not going to do anything, but I just want to know. I want to know if the cancer is progressing. So I want to go have the x-rays, or I want to know if I had a heart attack. But then I say, well, then if we're not going to do anything about it, then if knowing about it, you're just worrying about it more. Let us just treat the symptoms and let's find joy and peace in our life in what we're doing right now and not worry about that. So I hope this tip was helpful. If you have any tips that would be helpful for hospice nurses, please let me know. I'd love to share them here. And remember, together we can change our world.